Good afternoon, and welcome to the Health Leaders Long-Term Care Now Online Summit. My name is Eric Wickland, and I'm the Senior Technology and Innovation Editor for Health Leaders, and I'll be serving as your moderator for this session. It's our final session of today's event, and is titled Creating a Culture of Care to Recruit, Engage, and Retain Staff, and is sponsored by IntelliCare. Thank you to our sponsor and to you and our audience for participating today. Now, before we get started, I have a few housekeeping details. This program will be 60 minutes in length, and note that an on-demand version of this program will be available approximately 1 day after the completion of the event, and it can be accessed using the same login link that you used for this live program. To ensure that you see all the content for the event, please maximize your event window and be sure to adjust your computer volume settings and/or PC speakers for optimal sound quality. Next, you'll find a resources list for today's webinar in the upper right of your screen. Here we've listed the event program guide for you to download that provides topic and panelist information from each session, along with the materials from our sponsor. And at the bottom of your console are multiple widgets that you can use. To submit a question, click on the Q&A widget, and we will have a Q&A part of this program towards the end. It may be open already and appear on the left side of your screen. You can submit questions at any time during this presentation. However, please note that it's likely we'll be answering them in the last 10 and 15 minutes of the program. And finally, should you experience any technical difficulties during today's program and need assistance, please click on the Help widget, which is a question mark icon and covers common technical issues. Excuse me. At this time, it's my pleasure to introduce our panelists. We have Rosanna Benbo, RN, CCM, ICC, DNSCT, QCP, and RACCT. She's the owner and MDS consultant for Leading Transitions. We also have Andrew Loomis, SPHR SCP, Vice President of Human Resources for Avamere Skilled Advisors. And we have Matt McKendy, Chief Revenue Officer at IntelliCare. Thank you all for joining us today. And with that, let's get into our conversation. I'm going to start right now with that first question that's come up. What causes most of the high employee turnover rate in long-term care facilities? And I'm going to go straight to Rosanna to start this conversation.
Thank you so much. I think that this one is probably multifaceted, and I'll focus on the word most because I think, especially as we are coming out of the COVID-19 pandemic, I think initially a lot of the mass exodus that we experienced was fear, working in healthcare, fear of taking infectious disease home to one's family. I think the staffing issues are the cause of the turnover. I think those people who truly want to go to work and they struggle to take care of people on a day-to-day basis because they don't have the other staff present. And if they do, very often it's agency staff that is not 100% par. I think people struggle with that more than anything, and it just makes them want to leave the industry and go someplace where they don't have the pressure of having to take care of a person, because when you fail at taking care of a person, that's a pretty big failure.
Okay. Andrew.
Yeah, I think Roseanne's definitely hit on something, especially in that last point. I think a lot of us overlook how stressful and demanding these jobs are because you are taking care of another person. And people have needs and they're not always at their best when they're in need of care. So you couple that with the stress of the pandemic and then what's traditionally been a lower wage, lower benefit bearing work environment. And that's really put a lot of pressure on people in that industry to reconsider what their options are, to look at different industries, different jobs, especially as we're coming out of the pandemic, so to speak, and we're seeing large hiring efforts by companies. We hear lots of people say things like, well, why should I do this job, which is so hard and demanding, when I could work at some other company for the same amount of money or for close to the same amount of money. So those are definitely big drivers that Roseanne hit on that I would agree with.
All righty, great. Matt.
Yeah, thanks for the opportunity. We usually see things on the other end, right? So IntelliCare being a workforce management company predominantly focused on technology, but we have a pretty large workforce as well that we deploy. We usually hear from folks after they've either been burnt out, or I agree with everything the rest of the panelists just said, and they get to that point, they want that flexibility and control themselves. To add another slice on this, though, it feels like there's still a misunderstanding of what flexibility means. Right now, just hearing from a lot of people that we're offering more flexible shift times, and that usually means the duration of the shift, 4 hours, for example, instead of 8-hour shifts. When we poll our nurses and CNAs, we largely hear that pay is not the number one thing they're looking for. They're really looking for flexibility. But when you peel back that flexibility onion a little bit, it's complex, right? Because long-term care or care in any setting requires consistency and quality for a set amount of time to make sure the patient gets, or the resident gets, that attention for a specific amount of time. The problem is society is leaking into healthcare a bit now, right? For better or worse. People aren't jumping back in cabs after, Uber being around, and we're not going back into ATMs to get cash anymore or to deposit checks. And, we're not picking up newspapers anymore. It's not going back in that direction. So there's a balance in the workforce, and that seems like a Star Wars reference that we have to find, around how do we really continuously as an industry figure out how to understand what flexibility means. Right, during COVID, it was childcare and safety concerns and everything else. And post-COVID, it is, kind of the remote world. Look at us right now on a remote webinar, right, and a remote summit. Care still needs to be provided hands-on, but there's a level of flexibility and an ongoing understanding of what that means and how it changes that's really important, that is really leading people to come to us, or people like us, for example. And we have to help, people like us need to help long-term care refine that balance and help long-term care find what the definition of flexibility is outside of 4-hour shift times or flexible shift start times. That's just part of the story. It's an ongoing piece of engagement to try to understand what that means to that workforce and constantly evolving, those environments to make sure that they can receive that so that you can retain them. And hopefully that helps a little bit.
Yeah, certainly, definitely an industry in flux right now. So our next question, continuing with the idea of turnover. Part of turnover is the relatively low-pay long-term care employees earn. I think we just heard that, considering the nature of their work. Now, what's the best way to address this issue? Let's start with Andrew on this one.
Yeah, this is a pretty challenging one, because the easy answer is, well, just figure out how to pay more. But therein lies the challenge is, how do we figure out how to increase wages or improve the benefits that we're offering to our employees, while at the same time not creating a system or an environment that is so cost prohibitive that people can't afford to receive care. They can't afford to stay in our long-term care facilities because of our increased costs. So I think that goes back to the flexibility comments that Matthew was just making. One of the things that our industry needs to do is start looking at how are we operating and how can we be flexible with our modes of operation. So the remote work environment is one area where there seems to be some opportunities to reduce the physical footprints of our organization and the cost that we put into, grand offices and extra spaces that aren't necessarily directly focused on providing care. I think the other thing we need to do is look at the funding models that are traditionally supporting our organizations and the people that are receiving care. How are we working with those payers, if you will? How are we working with the state, federal government on those funding sources? How are we thinking creatively about that? And then I think all of that does have to translate back into some real changes for our staff, right? What kind of career opportunities do they have? So I might enter your workforce as that entry wage position, but I can't live on that space. So is there an opportunity for me to progress and stay with the organization that would result in more money, more responsibility, a better lifestyle for me and my family. I think that's going to be the ongoing challenge for us, is how to balance that money coming in with the wages and benefits that we're going to need to pay to keep top people in the field and attract new people to the field as well.
Okay, let's go to Rosanna. How do you deal with the concern about pay?
I absolutely agree with a lot of what Andrew said. I think a lot of the clients that I work with, they struggle with CNAs and housekeeping and dietary specifically, because they have industry in their area that pays much more than CNA wages. So it's a lot easier to go work in a factory than it is to take care of people in these stressful areas. And so I think that's definitely an area that we have to focus on, trying to get those wages a little bit higher. But absolutely, it's a struggle with our payment systems. We spend a lot of time fighting for the money that we get in the first place. So trying to balance that out. But I think that we have no choice but to really look at increasing those pay scales to be competitive with the other areas. I mean, I think we've all seen in the last couple of years, McDonald's minimum wages are like $15 an hour. Hobby Lobby in my area pays $20 an hour. So we have to be competitive with that to be able to get people in. And then I think that they have to feel rewarded in what they do. I think they have to be valued. I think they have to have good work-life balance. I can tell you with a lot of my personal employees, as they have left a full-time job in a nursing facility and now they work for me on an interim basis, their entire motivation is out of the stress of the building and having work-life balance. They can go home at the end of the day and they don't have to worry about who's taking care of those patients, because they don't live at that building. They're there on a temporary basis. And so I think that we have to find a way to make that for our long-term employees, where they don't live there and take that stress home, so that they can be rewarded when they are physically there in the building.
Interesting. Yes. Okay, Matt.
Yeah, just to dovetail on the two smart and accurate comments that were already made. Understanding flexibility is key. I think that was a great point too, focusing on state level change. I think in many ways, the industry has a little bit of the Shawshank Redemption syndrome, where he comes out from underneath the tunnel and the rain's falling on his head, right? That we think the federal government has to change the reimbursement models, and that's not changing overnight. Some of the smartest, kind of owners and operating groups that I've talked to are really influencing that type of change at the state level to start. So I think, kind of influencing those changes are really important. But I think it just goes to the last comment, right? What we hear all the time is people come to us. If anybody on this summit is thinking about, how do I fire my agency? Let me give you the hint, and that may seem ironic coming from us, is you have to not burn that person out. And that last comment was the most important one that they tell us all the time, and that is they feel indebted almost to the facility. So they want that part of the flexibility is not having the pressure of feeling the anxiety that comes with continuing to be in the building and being forced to work overtime and those types of things. So getting really creative about how do you shuffle people around to groups of buildings, even across corporations, would be smart, because you get to maintain that workforce and you're not worried of somebody, quote unquote, stealing your staff, but instead you retain that full-time person. But when they want to make that extra money, they don't feel like they're indebted in order to do it. They feel like they're doing it because it meets their goals. And you understand their goals and what their flexibility is, or whether they want to buy a car, or whether they want to go to Disney World with their kids, or whatever that is, and not because they're forced to work overtime. So I think you're really thinking about that creativity and allowing them that flexibility, and perhaps thinking way outside of the box and working with corporations and facilities in the same metro area or geographic area to share staff and be smart about how to manage a flow pool can really help people feel balanced, which puts less pressure on the pay. Again, we don't hear about pay as much. We hear more about flexibility and work-life balance, and burnout are the things that make people move over, which, we'd like to give back to long-term care and say, like, if we can help you solve those things, or you can help solve those things, then you deal less with pay. It's like gas stations, right? If you put two gas stations across the street from each other, when you go get into a commodity fight, you're fighting between pennies. Rather than increasing the value that you provide to the employee, then the rate, while important, doesn't become the only thing that you focus on, right? So that's what we notice when we're talking to folks. Nice, all good answers. Yeah, go ahead.
This is Andrew again. I was going to say, I think that's actually a really important point. In years past, we used to look at our competition for staff. Were the other long-term care facilities, and then it was the healthcare system players. It was the hospitals, right? We needed CNAs and LPNs, and they could get sucked up by the hospitals because the hospitals could pay more. But now we're in a market where we're competing with McDonald's, as Rosanna said, with the Amazons, with everybody. There isn't an industry stranglehold on our types of personnel anymore. And so that differentiator that Matthew was just talking about is what's the environment you're creating. That has to work hand in hand with what are you paying, right? So we still have to find what that competitive sweet spot is. It's more than the $15 an hour, but it's not necessarily, a lot more if you have an environment that is addressing that balance and that flexibility that Matthew was talking about.
Certainly. And coming from Maine, I love the Stephen King Shawshank Redemption reference too. Let's go to the next. The next question. Okay. Long-term care staff, from housekeeping to dietary to CNAs, historically have been undervalued until COVID came along and shined the light on their value as essential workers. Is that so true? How does the industry begin to right that ship to help them feel valued? Let's start with Rosanna on this.
I think this one's hard. It's a lot of it's a mindset. It definitely comes from the top down. I know I've worked in companies where they refer to them as the line staff. They refer to them as the low paid staff. I think that there has to be the value in what they're bringing to the table. I mean, I think that we can definitely look right at the CNAs and say, if it weren't for them, none of us would be able to do this. I think that it's harder when you look at the other ancillary staff members like housekeeping and dietary to get everyone to focus on that. But it's the same. We couldn't do it. I've worked in buildings when no one showed up for dietary, and it's really hard to get the nurses to go back and cook. You really have to have that focus on making sure they feel valued. And I think that we've done well with social media, with having dietary week and housekeeping week and CNA week, but they need a lot more than a week. I've seen the nice little Facebook memes where they say, if you need a week to celebrate how important your job is, you need a different job. And I think that is the best message right there. Why don't we celebrate on a regular basis? Why don't we focus on them and make them feel valued? Because at the end of the day, none of us want to have to go clean the rooms because they aren't there to do it. So I think that that's the very first place to start, is focusing on them on a regular basis and making sure we're valuing the service they're bringing. I know, again, we work in a lot of different facilities, and sometimes my staff call and say, the rooms are filthy, the carpet is stained. So if my staff are calling to say that, the families of those residents are very upset about what's happening with their family members and their elders. Those things are important for you to be able to grow as a provider. Those things are important just as basic humans. None of us want to live in an environment where we have dirty surroundings and stains on the floor. So I think that we need to elevate them to the level that they feel like what they're doing is making a difference.
Nice. Okay, Andrew.
Yeah, I think we're going to get tired of hearing the panelists say this, but I agree. I think for us, our focus on doing what Rosanna was just saying is, yes, we're doing the Nurses Week and the Long-Term Care Provider Week, and all of those kind of stock celebrations that we're all aware of. But I think the thing that we're focusing on the most now is actually developing relationships in the facilities. And what I mean by that is I get frustrated from an HR standpoint when employees say that they have concerns or problems, and you ask them, okay, well, what's your supervisor's name? And they go, Shelly, Susan? No, it's Jeff. It's Jeff. Which means to me that they don't know that person. That supervisor hasn't been able to connect with them on a one-to-one level. And as time-consuming and as problematic as it might seem when you're dealing with your mock surveys and your pending inspections and the various residents who are upset, or the family members, or supply issues, what have you, all the other things that distract us from probably our most important aspects of our job, which is developing our people and understanding our people. If you're not focusing on those relationships, and as Rosanna said, if you're not celebrating with them every day, the amazing work that they're doing every day, right? Cooking meals for an entire organization every day, providing great care every day. It's those one-on-one relationships that really drive home the message that you're important, you're valued here. One of the things that we do as an organization is we actually speak to our values when we have conversations with folks. We talk about, my job here is to make the quality of your life better. Well, I'm not a resident, but that's not important that you're not a resident. What's important is that you're here. And so my job is to make the quality of your life better. And hopefully that means you'll make the quality of life for the resident better, or for your coworker better. So really focusing on those individual relationships and just increasingly paying attention to what's going on person to person at the facility, which is time consuming. But it's so critical so that folks feel valued because they know the people that value them. If my boss isn't that nameless person, but it's Andrew, or it's Matthew, or it's Rosanna. And then vice versa. If your leadership team can't tell you who the employees are, they can't tell you what their life is like outside. I think it's important that if I have somebody that reports to me and they have kids, I should know that they have kids. If they don't have kids, I should know that they're single and they're struggling with trying to find a partner in a crazy world, right? And it's not that I need to be involved in their life, but I need to be aware of it, and I need to be, I need to recognize that comes into work, just like work goes home with them, if they really care about things, because we're whole people. But if you get your leadership team and your frontline staff to start having those connections, those relationships, that makes a huge difference. And people feel valued when they're known.
Nice. Okay, and Matt.
Yeah, I think that's exactly right. To quickly add to that, just people, it's kind of funny. My mother's a nurse. She's in her mid-80s. And if my dad hadn't got dementia and went into a nursing home, my mom probably would still be a nurse right now. And it's kind of funny when I talk to her about some of these challenges, having run a doctor's office and everything for many years. She's like, why don't people just want to come to work and be happy because they're providing care? And it's kind of funny because there's I still think there's plenty of that old school mentality in healthcare where it's like people should care. That's why they should come here. Well, for better or worse, the world is different than it was 10 years ago, much less 20 or 30 years ago. And the generation coming up through, for better or worse, kind of has to start with the why. You got to bring them to the why. Like, why are you here? Why is this important? What's driving you? And to the point that was made, you have to actually listen to people. And it goes back to the flexibility too. That was my earlier point. Don't just listen to them to try to appease them. It's like sticking a lollipop in somebody's mouth. It's like, oh, you want more flexibility? Okay, 4-hour shifts. It's like, well, actually, you didn't actually hear what I said. And that is actually driving people out even faster, is our observation, right? Which is the thought that they are listening and they're really not. And when I say they, it's just nebulous as an industry, right? And a perfect example is we've all driven by long-term care facilities. I've driven by a dozen of them this week that have the, bonus for a CNA sign flopping in the air, right? The nurses know that they'll get that bonus, and then next year they go back to the rate that they had before. They know that. And so that goes back to the previous point about pay. And those things were all important because those are recruiting strategies, and everybody's working hard to try to figure out how to recruit. But begin with the end in mind. You got to figure out how to recruit to retain, not just to fill a seat, and not just to listen enough to put it in a spreadsheet to say you checked a box. So the previous point, all about continuously listening, not just hearing, and figuring out, okay, how do we continue to evolve the model so that you're bringing people along with you and stopping them from calling people like us? It's the reality. Like, that will stop them from calling people like us if they feel valued. It's the Southwest model, right? If you take care of your employees, they will take care of everybody else. I would also say, like, we have to get the residents' families more actively involved in telling good stories. You can't be mad at the government for basically coming down on long-term care when they don't know what they're talking about in some cases. Good intention, but not actually working that way in reality. And, CNN and whatever, the stories are going to come from the bottom up, and they'll have more credibility if the residents' families are telling those stories. So there's a PR challenge in long-term care I think we have that wants to you want those employees to come work there, right? So you look at startups, like startups are a darling. You got all these startup, shows on Netflix and everything. Everybody wants to go work for a startup. And then, what is it, Superbad comes out? Or what was the story about Uber? You're like, man, that was a crazy environment. The more of those types of stories come out, and long-term care has just was the most responsive to COVID, right? And then was amazingly helpful throughout the pandemic. And they were on the front, quietly in the front line, all of long-term care. And then one bad story comes around, and people feel like, oh, I don't want to work there. You got to make it so people want to work there, and that the families are telling the stories, because you're not going to get very many friends in the media. They're going to try to tell those stories. And that's how you create an environment where people are like, I want to help. The why is there. It's mission driven. Like, people who want to work in long-term care are mission driven, and there's plenty of them out there. We've got to figure out how to work together, even people that have won on the sidelines and are still sitting there and are ready to work, to get them off and work in the right models all together to raise up the industry. Because it's look at the silver tsunami. It's possible and it's probable, if we all work together, that we evolve and become innovative and put the employees at the center, that we can tackle this.
All righty. This next question kind of goes right along with what we've been talking about all along, and I'm gonna, I'll start with Andrew on this. What are ways to help staff find meaning and joy in their work?
Yeah, Matthew kind of started to talk to this actually, in that most of our staff, actually probably a large majority of our staff, are coming to this industry and to this this space within healthcare because they already find meaning and joy in the work. It is true that care providers, they care. They come to do this because they care. And so I think our responsibility is to remove barriers to focusing on providing care, right? The meaning is already there. What happens is we layer on top of or in front of that meaning all kinds of other distractions and frustrations, so that the CNA or even the dietary services folks, they can't focus on what they care about because they're dealing with a bunch of other stuff, and it's everything from supply chain issues, so we're not getting equipment we need, to scheduling challenges, or schedulers having struggles, what have you. But it's again, it gets back to working with the folks on the so-called front line and understanding what is it that's preventing them from getting out and doing the care, from working with the residents, and from doing the thing that they actually like to do, and in many cases love to do. So I think it's really trying to be flexible as a leadership team and understand that your role is to clear the way for that frontline group. And that's how we provide care, right? That's often what I say is, like, my job is satisfied because I know that if I've eliminated some series of problems, that's freed up a whole bunch of people to deliver great care. And there's a question in the chat that's, do we believe quality of care has been impacted? And I'd say that's probably a yes, it has been impacted in some areas. In other areas, it has not. And that's predominantly because of the people that are delivering the care. One thing that I've noticed especially the last several years, is that as attentions and focuses turn on different areas or different aspects of our industry, the assumption is that the quality of care isn't there. One building has a problem, right? It becomes that CNN story. And then the assumption is, well, quality of care and long-term care is it's terrible. But I haven't found that to be the reality at all. What I've found is that we get distracted, and the more those distractions take away the time from our staff to actually do the things that they love, that's where we have problems. And that's where we need to focus.
Okay. Yes. Yeah. You mentioned the question that came in on the Q&A. Let's incorporate that into this answer. The question was, do you believe quality of care in LTC has been greatly impacted by high employee turnover? Along with, if that's the case, what are the ways to improve quality care, and how do you help staff find meaning and joy in their work so that quality of care is maintained? Rosanna.
Yeah, I think that I see a lot of variation from one facility to the next on whether or not that care has been impacted. Some of my clients have done great, and you can't even tell that we've been through a pandemic. Some of them had wonderful activities programs. Some of them have really struggled because of the lack of staffing, and you can see it through some of the quality metrics and the outcomes with the residents. I definitely think that having the meaning and joy is a great place to focus. I'm from the MDS side of things, so we're focusing on documentation, which is the distraction that Andrew talked about, or at least one of them. We all struggle to get the documentation done. And one approach I have found when I'm educating and trying to show why it's important, we all have to have those quality measures and outcomes and proof that we provided the care. All of that helps drive our reimbursement. So when I do education, a lot of times when I sit down with the staff, I ask them their why. Why are you here? What brought you to this industry? What brought you to be a care provider? What do you love about your job? And I think that helps. And I think we could find ways to do some of that on a more frequent basis, and not just because I'm trying to make documentation from, but looking at ways every day to ask them, what was your story of the day? What was the one thing that made you smile today in your day-to-day interactions with our elders? I can tell you some of my own personal most rewarding moments are when I get to go sit at a bedside and just talk and hear stories. To care for the elders is rewarding all by itself, but you have to be able to have the interaction with them. They have to be a person and not a thing. And so teaching that approach for our new staff and focusing on that approach for our longer term staff so that they're able to reflect on why they're here and the impact that they're having.
Nice. Okay. Matt, the idea of, these aren't necessarily, or they can be distractions, but they're also necessities. Documentation is a necessity. Yeah. How do you balance what those necessities are with, finding meaning and joy?
Yeah, it's an interesting question. What I think is really interesting, particularly about the nursing profession, and I've seen plenty of it, right, even in the hospital settings, is this expectation that a nurse comes in and knows everything to do. So it creates almost a punitive environment out of the gate. And bear with me for a second. What I mean by that is everything we just talked about with documentation, it becomes you didn't do this, you didn't do that, you didn't do this, and didn't do that. What's really interesting about the profession is the awful amount of pressure nurses have with even less staffing and support, so less people to help them develop, and less mentors. Like MDS nurses alone, there's a massive shortage of MDS nurses in the country. They could potentially help raise up the entire nursing profession to help them understand the why they should be documenting. So I manage sales teams. For those of you who ever managed a sales team or a marketing team, I can yell at people and say, you got to put everything in Salesforce, which is the CRM. And they'll probably do it to a certain extent because somebody like me told them to do it. And then they'll stop doing it and I have to remind them. And you create this punitive cycle of just having somebody feel like they're watching you instead of having a cycle of them understanding the why that's important. You know, not so for the longest time, nurses are treated, and just being real, I'm not, you know, saying this to say anything bad about anybody in the industry, they're treated as a cost center rather than a revenue center. When there's how many X more nurses providing care than physicians, which are seen as a revenue center. Really interesting dynamic, right? And then you try to be punitive about all the things they're not doing instead of developing around the things that they want to do. And I'd also add joy. Joy is feeling like somebody listened to you and you're progressing, right? Like the old saying is, if you're not growing, you're dying. How many people can say that they know every nurse and CNA in their building and what their growth goals are? I do it in a corporate setting, right? I can look out my door right now and I can tell you each person in this team that has a goal and where they are, and they're having conversations with their managers, and then I'm holding their managers accountable to having those conversations to make sure you understand their development goals. So people won't leave and go work at Target if you know their goal is to become a CNA to an LPN or RN, and you're helping them learn in a positive way to move through that, you know, to move through that cycle, rather than be punitive that you didn't do this and the business needs to make money. They kind of don't care the business needs to make money, because in their mind, they're burning through their eyeballs, right? Because there's not enough staffing and they're burnt out. So the why is assumed that it's like something that has to happen, like my Salesforce example, instead of when I walk a salesperson through and say, suppose I said if you put this in Salesforce, they're going to get twice as many messaging from marketing, and therefore it's going to make your job a lot easier. Would that help change your mind about it? They're like, oh yeah, I should do that. And then they're doing it because they want to, because there's a benefit to them, rather than assumed they have to do it because it's punitive or an authority told them they had to do it. So, like, for example, we hear about documentation all the time, and that, you know, folks that we send in aren't completing documentation. So we spend a lot of time trying to work on that. We try to work on it, like helping them understand the business reasons why, and they tend to be more receptive to that. Oh, like people want to help. And if you make it about like helping to the greater good, people are more likely to do it than being punitive. And I just think it's really interesting how punitive the industry can be. And unfortunately, the government has put that down on the industry, but the industry has an opportunity now to raise that up through and act a little bit differently inside its walls versus the pressure that they're getting from the outside. And that's really easier said than done. But again, it's Southwest model. You take care of your people, they'll take care of your residents, and you'll have good care. And then they'll feel appreciated and they'll have joy in their life.
Well, it's also about, you know, in taking care of your people, it means understanding what is going on for them.
Yeah.
We keep picking on, you know, documentation as if that's the problem. But I think if you talk to more of your folks, they want to be able to document, but they have trouble logging into the system, or the system is down, or the Wi-Fi is down, or they don't actually have enough laptops or tablets to be able to get into the system. So we put all these other barriers in the way of doing the right thing, right? The quote unquote right thing. And then we don't listen to them when they say, hey, if I just had I could do this a lot faster, right? And then the other barriers that we put in there are these distractions, the non-work distractions. Hey, my paycheck looks a little bit funny. Did I get my PTO? Did I get, you know, I had a question about 401k and nobody's called me back for 2 weeks.
Yeah.
You know, what's going on, right? If I'm thinking about all of those distractions, right, I'm not able to focus on the care I'm providing in the moment.
Yeah.
So again, I think, you know, again, I agree with what the other panelists have said, and the more we can focus on a less punitive, to use Matthew's phrase, a less punitive approach to our staff and a more problem-solving approach to meeting their needs, they're going to meet the needs of the residents and accept them.
Because the joy will be the smiling face, right? The joy will be the resident who feels like, you know, they help them either get released or help them in the last days of their life and their family, like that whole spectrum. That's why people work in long-term care, to feel that that joy ultimately. And, you know, it's easier said than done, just given how punitive I think the government and regulation can be on the market. But I think long-term care as an industry has an opportunity now to get together and rise above that, and really, try to empower the people providing the care. And you'll find that outcomes get better when you do that on all levels, not just reimbursement outcome or revenue outcome, but you'll even see the PR problems start to get addressed organically, and that's really a big opportunity that we have.
Yes. Yeah. Okay. I know we've discussed this a little bit. I want to continue with the questions here, and I'm going to start with Rosanna on this one. You had mentioned earlier the idea of it's not a week for employee week or whatever, but continual reassurance and placing value on them being a member of the staff. What are some of the more innovative initiatives that administrators can adopt to show that staff are valued and help to keep them working within the institution?
I really like this question. And I know that Andrew kind of mentioned some things earlier that go like firsthand. Administrators should know their staff's names. If you have staff members that are in the building that have been there for longer than a week and you don't know their names, that's the problem from an administrative level. Absolutely knowing things about the staff is important. Being able to ask about their children by name, ask how their trip was, ask about their weekend activities. And those are not necessarily innovative. Those are just basic. But I think that the presence of that interaction is so very, very important. Some things I have seen that are really cool, though. I know administrators that have a cart full of, there's a cooler with pop and candy bars and chips, and they literally go out at a certain time every day, once a week. It depends on the particular individual, but they go out and they talk to their staff and they give them some sort of little reward. It doesn't take that much money to invest in that. But it's a big thing. The staff really appreciate it. Just that little bit of recognition, and they got something they didn't have to pay for and bring to work themselves. That is a great thing to do. I definitely think having some system to respond when you do have staff concerns is also important. So many times we hear that I've talked to them, I've told them, I've asked them, I don't hear back from them. So have some sort of a follow-up system on all of those little concerns that you might have. And then lastly, I think that value, celebrating the day-to-day successes, that the residents look great, that they are smiling, that they're enjoying their meals, that they are out and participating in activities. It takes a lot just to get them down to the activity. It's a team effort. The activities can't necessarily get them all up and transport themselves. So celebrating with the entire team those successes on a daily basis, I think, are so very important to make sure that from that administrative level that you're recognizing and interacting with them.
All right, great. Andrew.
Yeah, I mean, many of the things that Rosanna just talked about are definitely valuable activities to be engaged in. So I want to add to that some of the things that I've seen our organization trying to implement. Just very focused mentor programs, especially with pairing new folks with that long-term employee, the individual that sort of knows everything and is aware of everything, and providing them both an opportunity to gain from their experiences, right? The long-term person has an opportunity to gain some of the enthusiasm they had when they started, to regain that, to recapture that. And the new person gets a automatic insight into not how it's supposed to be done, but how it is done, right? From that long-term employee that they know the tricks of the trade, they know all of the special little extras that might need to be engaged in here and there. So really having a focused mentor program and making sure that everybody goes through that mentor program. One of the things that it's not innovative, I don't think, but it is something that's been lacking, is just really taking the time to onboard somebody instead of throwing them right into the day-to-day work in that first week, right? So introducing them to the organization, helping them understand what they're a part of, who they're working with, what the organization looks like, even just the physical layout of the location. And then on the longer term side, working with other organizations in your areas on development programs. I don't think that we as an industry do a great job of thinking about how do you develop your CNA. And that doesn't just mean that every CNA has to become an LPN and every LPN has to become an RN and so on and so forth. But what are we doing to enhance their education and their experience at work beyond just having them do the same activities every day? So partnering with some of the local education institutions and providing opportunities for them to expand both horizontally as well as vertically is I think, pretty important.
That's an interesting concept. Now, we talk in healthcare about social determinants of health, other factors outside that affect healthcare. There are other factors that are affecting your employees, your staff, that go beyond what you traditionally think of. You talk about education, you can talk about child care or elder care, other factors that are weighing on your employees that may be affecting their job. Matt.
Yeah, absolutely. Say, we have in various pockets of our organization, we have large groups of employees that are not native, and they come to us and they do a great job, but then they go into their personal lives and they struggle with things that we as native speakers of English take advantage of or assume that everybody can handle. Financial literacy, dealing with banking in this country, dealing with the DMV, things like that. And so even just providing groups of employees opportunities to go do a financial literacy class that's paid for by the organization. If English is a second language is something they want to work on because they want to be able to communicate more effectively. Even just allowing them in the workplace to speak with their peers and colleagues or their mentors in a home language or in a more comfortable language, and recognizing that's not a problem, but that's actually just communication, and more communication is positive. Giving them the opportunities to just be more comfortable in the work environment by being more comfortable outside of the work environment too, I think is something that's been helpful for us.
I love the wide range of resources we've talked about here. It's from assistance with certain things all the way down, and I love the snack cart idea. I think that's perfect for long-term care facilities in order to allow staff to feel a little bit more valued each day. And it's amazing. We've already had 47 minutes of conversation. I thought we started like 5 minutes ago. This has been fantastic, but we are 13 minutes to the end of this session. I just wanted to remind our audience that if there are any questions you have, enter them at any time, and we will answer them as we can. We still have a number of questions here, and I'm just going to keep continuing. I do have one question coming in that I'll get to shortly. I just wanted to get to this next one here. And actually, it's something we just talked about as well. How effective is investing in an employee with training and providing a career path? Let's start with Andrew on this.
Yeah, this is always an interesting challenge, right? The push is we've got to have a career path. Everybody needs to have an opportunity to grow and expand. And then we provide training or we support people going back and getting their LPN or RN. And then we find, but we don't have the job. We don't have the next position. We don't have an LPN job for all of our CNAs. And then the other thing that we run into is not all of our CNAs want to be LPNs. Some of them, they really like this, but they still want to grow and expand. So I think our traditional thinking of this continually vertical move up a career path, it has been a little bit antiquated. It's certainly the model that I grew up in and the expectations that I was taught, that you constantly need to be moving up to the next job, up to the next space to have a real career path. And I think our staff and our teams now are helping us rethink this, that a career path isn't necessarily vertical. It can be lateral, it can be horizontal. So understanding that there are niches within our industry, and then really encouraging folks to explore those niches But then as a employer, recognizing that if you're going to encourage folks to explore those different opportunities or those avenues of opportunity, you need to be thinking, okay, how are you creating the space for them to utilize that skill set, to utilize that new knowledge? And I think that's been our challenge, is how do we invest in career path in a broader sense, rather than just it's a promotion opportunity and everybody's going to have to try and get to that next promotion when there are fewer of them.
Okay, nice. Rosanna.
I absolutely love that message. I'm going to back up though, and I'm just going to talk about the initial training. I think career paths are great, but I think initial training is a great place to focus. And, we mentioned a little bit the struggles that we have in all roles. But when we look at new nurses, we look at new MDS nurses, new DONs, new administrators. We need these roles in our facilities, and the training just isn't there. That what I've seen some companies do, which is great, is 2 weeks training for new nurses. I think that should be a minimum. If they're a brand new nurse that just graduated college, 3 days training is not going to work. You have to have a good system in place to make sure that you're not going to have med errors, that you're not going to overwhelm them to where they just need to leave because they have too much responsibility too early. I mean, we definitely have to look at, especially as we're bringing in younger people from a different generation, their viewpoint, they're very me focused. They're not necessarily focused on all of the other things. Even if they have a care calling, they're still very focused on themselves and what's happening to them right now. So bringing them into this stressful situation where they're already struggling socially, they're struggling with adulthood, and now we've put them in to take care of 20 residents, they're going to need a little bit of extra support, and that needs stretched out. And the same with the other positions. When it comes to MDS nurses, it's very specialized. You can't expect that someone's going to take this position and be functional within 2 weeks. That's a much longer path for training. I always say at 6 months, you kind of feel like you know what you're doing, but you're wrong. At a year, you are confident you know what you're doing, but you're still wrong. And then we get about 1.5 years in and they change up all the rules on someone. So, the training is so very important, and not just the initial, but that ongoing with updates, changes to policies and procedures. There needs to be an increased focus, and it's not just plugging them in front of a computerized training. Certainly it can be mixed in with that, but you need the personal touch when you're training all of these different positions in the facilities.
Yeah.
Nice
if
answer.
I can jump on that for half a second? Yeah. It's kind of funny. I was having a conversation with a whole group of owners recently, and it was really interesting. I asked them about their training adoption rate, and they were somewhere between 20 and 40%. And then they turned around and said, yeah, but it's table stakes and you got to do it. And it's like, wait a minute, what? You have like 20% uptake and then you're upset about what the cost is for the training. What's really interesting was the last point, which is how people learn is really important. And if you look generationally with how people learn, in the past 50 years, people learn less and less by sitting in front of a Zoom or sitting in front of whatever, and just taking in all the content and then regurgitate it back out in some sort of test, and then you've learned. Bite-sized learning is incredibly important, and also listening to what they're struggling with and what they have to learn with. So here, everybody has a nurse advocate. So we call them IntelliPro Success Managers here, and they're the individual advocate for that person. And to the earlier point about charting, we found out when we were talking to one nurse that she's dyslexic. She's kind of embarrassed to tell the facility she is. So when you go in and you think, that nurse didn't chart or whatever, and you go in thinking you're going to have a punitive conversation with them. No, you didn't ask them really, why didn't you chart? I really struggle with this. I'm afraid to tell them, and the system's really hard to use, and it really confuses me. It's like, let us help you with that. And then that's not a problem anymore. But that goes to bite-sized learning, understanding how they learn, and then experientially in putting in bite-sized learning. Some owners and operators are starting to really think about that. I think it's really important because sitting behind a screen and learning is getting worse. The adoption rate is not getting better. right? It is literally, and the fact that we all now sit on Zooms every day, and that's become a cultural norm, is actually reducing the absorption level because people are tired. You don't want to sit in front of a screen. So, bite-sized learning, I think, training is important, incredibly important, but it has to be experiential and ongoing in bite sizes rather than checking boxes, because that's not learning, that's remembering. And learning is more part of you. Remembering is to be able to regurgitate it back out to prove you did, but it's still not necessarily part of you and how you operate. And nurses are lifetime learners. That's awesome, lifetime learners, but you have to nurture that in a way that they're going to consume the content. And I think we need to take a deeper look at that.
Yeah, I think this pairs well too with what I believe Andrew said before about a mentorship program.
Yeah.
New employees paired with someone who's already been there for a while, who knows the ropes, who can help with some of those things you don't really think about when you've got a new employee. We got 5 minutes left. Actually, we've got 4 minutes left. I'm going to get to that one question we've got in here now that I wanted to get to. And it's an interesting one. I wanted to hear what your answers are. Since workforce is a concern, have any corporations elected to place a moratorium on opening any new facilities in the near future so that they can rebuild the workforce and provide optimal care? Are you hearing about that and any sort of moratoriums out there? I'll start with Rosanna on this.
I'll say not so much on opening new facilities, because those are usually years lined out plans. So if someone's planning on opening a new facility, I think they're probably still going to do it. I will say I have seen good providers look at their staffing situation, look at their employment pool, look at what's around them. And when they're not able to fill the holes on a regular basis, I have seen them stop admitting folks. Make sure that they're taking care of the ones that they have now and doing good quality care, and then adjusting that process as they get more staff in. So I think that is a great responsible thing to do as a provider. I can tell you years ago, I did a small stint as a DON for about 9 months. And that was our biggest challenge. It was a really big corporation, and it didn't matter if you had staff or not. They were going to take admissions as admissions came. And it's really hard to get 3 admissions in a small building with 1 nurse and then a call in on the next shift. You want to make sure that patient coming in gets a good experience. You want to make sure that you have good assessments. You want to make sure the family's concerns are addressed. And if you have 2 people in the building, that's probably not going to happen if you're admitting 3 residents. So I haven't seen anyone pull the plug on new buildings, but I definitely have seen them look at that census process.
Okay. Andrew.
Yeah, I think our approach has really been to look at the environments that we want to operate in and trying to make an assessment of, is there a need for a new facility and what's driven that? What drives that need? Quite often, if we're pursuing a new building, it's because either the existing infrastructure or the existing competitors are inadequate for the demands. And part of our calculus for, yes, we want to operate in this area is there a potential to staff that, right? So we do try and calculate that into our projections. But to Rosanna's point, those are often, a couple of years out. So whether or not we would put a moratorium on a build because of current staffing, I don't think that would be the case. I think where we've elected to either grow or expand, it's because we're confident that there's an opportunity there that it justifies that new space. In some instances, it's also because the other locations that we have in that area are insufficient, probably need to be decommissioned and replaced. And so we're not necessarily creating exactly a new organization or a new building, so much as it's a replacement building, because it's more cost prohibitive to repair or address the old building that's not meeting our residents' needs. So it's quite a complicated mix of issues that go into those types of decisions. And staffing is a part of it, but not quite in the way that the question implies.
All righty. Matt.
Yeah, quickly, I just came from an investor conference last week in DC. And I will say there's lots of money in the market. There's lots of investors looking to invest in long-term care because they see the silver tsunami coming. So there is going to be pressure around building new buildings. I am hearing a lot about, kind of moving to single residency rooms with showers, and that goes to the point that was just made in terms of, all the complication with rehabbing a new building versus an old building versus building a new building. I do think there's going to be investor pressure that's going to exacerbate the problem if long-term care wants to continue to evolve, right, which it has to. It is going to put some pressure on that. That said, these newer models are more, patient-focused and patient-driven. So that should actually increase the purpose for which people want to work in long-term care. Hopefully that comes out as being innovative and a new level of innovative care that makes them want to be a part of that. To me, that seems like an opportunity rather than something that we should be afraid of. That's something we should embrace because you're either growing or you're dying. And if long-term care wants to grow and continue to provide great care, we have to embrace this. And that will actually make people come off the sidelines and want to work, or cause people who are coming out of nursing school to want to go into long-term care. If you have those new innovative working models and a blend of home and in facility, really have to be entrepreneurial, and that is something I think we should embrace rather than be afraid of.
Yeah, certainly. And we could go for another hour on how this field is innovating with new technology, new strategies. We can talk telehealth and so on and so forth. However, we have hit our hour, and that's all the time we have for questions today. I want to thank our panelists once again for an excellent discussion. This has been a fantastic hour, and our sponsor, IntelliCare, for making this program possible. Over the past several hours today, during this event, we've heard from healthcare experts and our sponsor about key strategies and tactics for tackling the needs of healthcare organizations, as well as making sure you're set up for future success. We look forward to seeing you again for future Health Leaders events. And believe me, there are plenty of them coming up. This concludes the Health Leaders Long-Term Care Now Online Summit. Thank you very much.